and welcome to this session where we'll be talking about the Durable Data Assessment Form. I'm Charlie Wakeham. I'm the APAC GXP Compliance Manager for Waters. Regulated data has a real financial value to an organisation. It's cost time and money and significant effort to generate the data. So it's very important that just like any other asset in your organisation, that data needs to be protected. It needs to be available when you need it, whether that's supporting a quality decision or defending your practices in an audit. And yet far too many companies have gaps or weaknesses in their approaches to protecting their data. Let me tell you about a real-life drama one of our customers went through. So in June 2017, there was a very famous and very vicious virus attack, the NotPetya virus. And what it did was it sought out and attacked Microsoft systems that hadn't had a particular security patch installed. So the patch should have addressed the security weaknesses. Without the patch, NotPetya was able to attack the system. Now it positioned itself as ransomware and tried to extort money from infected companies with the promise that they could then recover their data. But in reality, there was no way to recover the data. NotPetya encrypted the data so it was unusable, and there was no way to unencrypt the data. At one global pharmaceutical company, pretty much all their network PCs that they were using in their Empower enterprise were infected. Now, it wasn't just Empower. It infected most of the PCs in their company because the patch had not been installed on them. But obviously, the focus here is on Empower. So with those network PCs gone, it took down Empower for their global manufacturing and R&D labs. Some of their data was never recovered, and it took a full 6 months to get their labs fully up and running again. Later in that same year, Hurricane Maria hit Puerto Rico. Puerto Rico is very important in the pharmaceutical world because out of the top 20 medicines worldwide, components of 11 of those medicines are manufactured in Puerto Rico. And our pharmaceutical company that got hit so badly by the NotPetya virus had a site in Puerto Rico that was hit by the hurricane. They were having a seriously bad year. The hurricane caused terrible devastation to the island. From a business point of view, it knocked out communications very drastically. And a year on, there were still major internet issues. The estimated impact of that cyber attack on that pharmaceutical company was $1 billion. There are industry assessments that say natural disasters have cost $650 billion to corporations over 3 years. How would you survive in a major disaster? Would you be able to recover your data? How long could you work without network connectivity? Would you survive financially? There are not many companies that can take a $1 billion hit and continue to operate. And in fact, much smaller losses can be enough to sink a company. And let us remember, we're not just an industry looking to make a profit. We're an industry that everyday people rely on to manage and maintain their health. And a major disaster could result in a drug shortage, which means a person can't get the right medication at the right time to treat their condition. Waters has put a lot of focus over the last 12 to 18 months on disaster recovery and business continuity. Before even the pandemic started, we were very aware that our customers were hurting under the impact of some of these disasters. And we got increasingly concerned that perhaps the customers didn't have everything in place to protect their data. And we wanted to take the lessons learned from the customer that suffered the NotPetya attack, lessons learned from Hurricane Maria, and see how we can support you in better protecting your data. So we're introducing a self-assessment form. It's really intended to help you assess for yourself in your lab, in your organization, how well protected is your data. We've all focused so very much in recent years on looking at the integrity of our live data, the data we're working with, we're creating day by day, we're reviewing, we're using. But you need to make sure that data is going to survive. And not just survive in the short term, but it needs to survive through the full regulated retention period, which is typically measured in years. Do you have everything in place that you need to make sure it's secure? So in our data assessment form, we have an area looking at architecture and cybersecurity, questioning about your backup and restore practices, disaster recovery and business continuity planning, your archiving processes and locations, and how are you managing your other laboratory data. Being a self-assessment form, it is intended that you can download this form and fill it in by yourself. Perhaps if you're a lab manager, maybe arrange a meeting with your IT support and together fill in the questionnaire. We are also very happy at Waters if you want to reach out to your regular service engineer and ask for a little help from them filling the form in. We can't guarantee that if you fill in the form, your data is perfectly safe, but we can at least help you to assess for yourself, are there any major vulnerabilities or weaknesses that you would want to address now, so that if a disaster does ever hit, you're in the best possible state of preparedness. So starting out, first of all, with architecture and cyber security. Fundamentally, you need to be using a server-client architecture. We've seen repeated warning letters from regulators expressing concern about regulated data on hard drives in standalone computers. The simplest way to mitigate that risk is move to a server-client architecture, which brings you so much gain in terms of uniformity of configuration across all the clients in the network, in terms of a single location to protect and manage your data and your backup and restore processes. Assuming you do use a server, where is it located? Is it a server room with controlled access, fire suppression, climate control? Are you keeping your operating systems current and patched? Remember, it was the lack of an updated, up-to-date patch that allowed the NotPetya virus in. Is Empower at the latest version under a maintenance plan so that you're always getting latest data integrity technical controls, latest application features? Do you have antivirus software in place for your server and clients? Of course, we want to make sure that your data is available and can be recovered should you have a disaster. So do you have a backup and restore SOP in place for your Empower data, defining how the backups will be managed? How often does your backup run? Does it run at least daily? Are you backing up the Oracle database and the raw data share? If you choose just to use the Empower function to back up an individual project, yes, you will have a backup copy of that project, but you will not have a copy of the system configuration. So if you had to recreate your Empower system, you would have none of your user accounts, you would have none of your system policies set as you need for your company. So you need to be doing a database and raw data share backup. Where are your backups stored? You can't leave them in the server, which is the default location that backup is written to. Because if your server fails, you've lost the backup as well as the original data. So you need to be moving your backups, copying your backups to a second location. You can even consider a third location. So a second location may be in another building on site, still local, still easy to get to when you need it, and perhaps a cloud storage location as an off-site backup that is isolated from any major geographical disaster or any major virus attack. Have you tried restoring your data? You don't want to wait for a disaster and then find out. Perhaps you're not sure how to restore the data. Perhaps you haven't been copying the control file up with the backup set. So do a trial restore. Think about repeating the trial restore anytime you change something in the infrastructure or the backup scheduling. Backup and restore is just one element of contingency planning. You also need to think about disaster recovery and business continuity planning. So at the disaster recovery level, we're saying it's not just the data that's gone, potentially the whole Empower system has gone. Hardware, software, and data. So the first step in your disaster recovery plan would need to be to recreate the Empower system with new hardware, new installation of the software, new qualification of the system. You can then restore the system configuration and the data from the backup set, either your second location backup set or even your off-site really big disaster backup set. But of course, chromatography data systems not just about computer hardware and data. So you would need to have an arrangement in place, typically a service level agreement, as part of your disaster recovery plan, to make sure you can get replacement instruments in a short space of time from Waters, so that then you have your full chromatography data system back in place and ready for use. If you are using older IT equipment, so perhaps outdated servers, Windows 7 PCs, perhaps some of the older Waters instruments, then getting direct replacements becomes almost impossible. You're left with searching eBay looking for a Windows 7 PC. It makes disaster recovery more difficult and much, much slower. And everything in your disaster recovery and business continuity plan is about getting back to full operation as quickly as possible. Typically in BCP, we define that in terms of the recovery point objective and the recovery time objective. So the recovery point objective is really a realistic benchmark of how much data you're prepared to lose. So if your backup is running every night for your lab data, you're effectively saying you are comfortable to lose 1 day's data. Your recovery point objective is 1 day. Any more than that, and you see it as a major issue. The recovery time objective is about how quickly can you get the system up and running again so that you can start new analyses. Now, you can set the objective, and you might say, well, we don't really want the lab to be down more than 2 days. It would be very difficult to lose our QC capabilities for more than 2 days. But that means you need to have agreements in place to get replacement IT hardware, replacement instruments, new installation and qualification, all done within 2 days. It's not impossible, but it would need some pre-existing agreements in place. You couldn't just rely on phoning any vendor and saying, I've lost my whole lab, I want complete replacements in 2 days. It's not going to happen. And in fact, the best way to really determine if your RPO and RTO are realistic and achievable is to test your disaster recovery and business continuity plan. Obviously, you don't want to destroy your system for real, but walk through the plan. Contact the vendor. Okay, I'm having a simulated disaster recovery test. How quickly can you get me 2 instruments in place? How quickly can you get software installation and qualification done? Walk through the plan. Make sure everybody involved knows what to do. There's an off-site copy of the plan available. And measure whether those objectives are realistic. If you don't hit the objectives in the plan walkthrough, the simulation test, you either need to amend the objectives to what you achieved or look at improving the effectiveness of your plan. So some basic considerations around business continuity. What's covered? Is it going to be all of your lab systems and you have a business continuity plan for the lab? Is it going to be part of a site-wide business continuity plan? Do you maybe say, well, you have 10 instruments, but, worst case scenario, you could get by on 4, so you're going to make arrangements to get 4 replacement instruments available under a service level agreement with the vendor? You need to work these out internally. Who's going to action your continuity plan? Who's going to step up and implement it and make sure it happens? Who's going to communicate with all the stakeholders in the plan? Whilst you're recovering your system, is there another lab, maybe at another site in your company? Maybe a contract testing lab that you previously have reviewed and approved as a viable alternative? Is there somewhere else you can transfer that business process whilst you restore your system and your lab? Do you have an Empower BC LACE so that you can continue with standalone Empower operation if your disaster involves a prolonged network outage? So far, it's all been about losing data, losing systems, surviving through disasters. So, whilst you'll always be doing your backups, you may not, in reality, have to restore very often. Hopefully, you don't have to recover from a disaster very often. But the one thing you're always going to need to do routinely is to archive your data. How long do you need to archive the data for? Different country regulations specify different time periods. Different types of data need to be kept for different time periods. So, for example, if you're making an oral solid dosage form, it has a 2-year expiration date, shelf life. You will need to keep the batch release data for that batch of products for 1 year after the expiration, total 3 years. Fairly simple. The data around the batch of products used for your clinical trial data itself, they will have much longer retention periods. Need to think about how and where are you going to archive your data. If we're talking about chromatography data, you have to keep the original electronic records. You can't just keep printed reports. That's not considered a true copy of your chromatography data. It would not satisfy an auditor. So your data needs to move electronically from the original system to an archive system. And the best way to do that, to protect the integrity of the data, to make sure all of the data is copied across, is to use an automated archiving system such as NuGenesis. You can validate the archiving mechanism, and Empower will contain audit trail entries identifying when each project was archived to NuGenesis. Now, the final element in the self-assessment form really recognizes that whilst Waters may think chromatography is the most important thing in the world, actually, in reality, your lab is going to have a whole host of other instruments. You need to do more than chromatographic analysis as part of your quality control on your product. And actually, the data from those instruments is just as important, just as critical, just as required under the GXP regulations as the Empower data. So whilst the focus of the self-assessment form is on ensuring your Empower data survives, do need to give some consideration to the other data you have. Now, very often those instruments will be controlled by a standalone PC. Is the data on those standalone PCs backed up at least daily? You don't want to lose that data, same as you don't want to lose chromatography data. How are you archiving that data for its retention period? Now, I mentioned NuGenesis is an automated archiving system. It can actually provide both a backup and an archiving functionality to the data stored on those standalone computers. So if you implement NuGenesis for automated archiving of Empower data, you get this additional benefit that it can solve a lot of your durable data concerns around your other instrument data. So to really have durable data, there's a lot of aspects you need to consider. And just as a quick summary, I'm just going to work through this infographic. So where is your server located? How's the access managed? How's the environment controlled? When are your backups running? Are they nightly? Where are you copying the backup data to? Do you have that SOP in place? When's the last time you tested your restore? And where did you restore to? Because if you restore to the original system and something goes wrong in the restore process, you've potentially corrupted your original data. So don't restore to the original system. You need to restore to a secondary server or perhaps a virtual machine. Did you document the restore? Did you circle back and see whether you needed to make any updates to your backup process or to your SOPs based on testing of the restore process? Do you have your disaster recovery plan available for Empower? Have you tested it? Are all the necessary personnel trained on what to do and how to action that disaster recovery plan? Business continuity plan may be looking at more than just recovering an Empower system. So do you have it available? What systems, instruments, labs are covered by your business continuity plan? Do you have an alternative plan in place for another lab, internal or external, that could carry the QC load whilst you're getting your systems restored and back into operation? How's your archiving happening? Where are you archiving to? When do you archive? Do you archive immediately after a batch release decision is approved? Do you perhaps archive 3 or 6 months after that? Do you leave the data in Empower for the first year so you can do your annual product review and then archive after that? These are all decisions you need to make internally, but I do strongly recommend using an automated archiving system. Cybersecurity. We've seen the scary data around what NotPetya did to that global company. So are you putting the patches in place as soon as they're available? The hackers know what day Microsoft released their security patches just as well as your IT department does. And the problem with publishing information about a security flaw to explain what the patch is and why it's needed is they're effectively giving those hackers here's the security flaw you might want to exploit in a virus instructions. So, if the patch comes out, it needs to get installed. You need to have antivirus kept up to date. You may need a little help from your Waters engineer configuring exceptions for certain Empower folders so it doesn't interfere with Empower operations. Stay up to date. If you're on the latest operating system version with the latest patches, your risk of cyber attacks is much reduced. Keep your Empower version up to date. The easiest way to do that is a maintenance plan, so you're automatically entitled to any updates that come out during the plan duration. It means you're getting the latest technical features. You're also getting the latest improvements to the code and the application. So really, when we're talking about durable data, the motivation to care about durable data is, it's not if, but when a disaster is going to happen. Now, they come in different scales, and perhaps losing a client in the network is not the biggest disaster in the world. But it could be so much worse. It could be the network itself. It could be your entire lab. So be prepared. Thank you very much for your time today. You can email me any questions or connect to me via LinkedIn using the QR code for questions and for my updates and industry news. The Durable Data Assessment Form that I've spoken about today is available at waters.com, along with a detailed white paper explaining the durable data concepts and an easy aide-memoir infographic on the topic. You're very welcome to contact Waters for help completing the assessment form, but also if you'd like our suggestions on how you can mitigate any weaknesses in your data durability that you've identified through the form. So do please feel free to reach out to us with the completed form for our advice and support. Thank you very much and goodbye.